So it's a very minor surgery that we do under local anesthetic. So the implant is first placed into the gap, so the teeth is already gone. There's a missing gap there. The implant is put into the position, and generally it requires a healing period of 4 to 6 months. And during that time, the bone heals around the implant and anchored in place. And once it's all healed, we're ready to put a crown, which is a tooth, over the top of that implant, and it's connected permanently, fixed, and you can't remove it. It will just be like your own tooth. And you clean it and look after it as if it's your own. You do need to have it maintained and looked at regularly to make sure, because the tissues around the implant, the soft tissue and the bone can still become infected, whereas the implant itself, made out of titanium and porcelain, it will never decay, but if the tissue around it start to disease or become infected, you will eventually lose that implant. So it is not something that you put in and you forget about. You still need to come in and get it checked regularly by a dentist, sometimes with x-rays to check, make sure the bone is healthy, to make sure the long-term success of the implant. So depending on where the implant is, if it's quite far back, obviously it's not a major cosmetic concern, and sometimes we'll leave it as it is, just have a gap there. If it's in the front, obviously we can't have you walk around with no teeth, so we will make you a temporary tooth in the meantime while that implant is healing. If there's not enough bone, there are many ways of augmenting bone or make bone. Depending on where and what the situation is, it may be a bit more complicated, and we may involve an oral surgeon to help us in that regard. But generally, it can be done. It will just be a little bit more involved and a little bit more costly as well. They will last. I say to my patients, you should expect 30, 40, 50 years without any problem if it's looked after, if it's maintained. So it's important to come back. And also at home, we will show you how to look after your dental implants, and coming back regularly and get it checked is very important to make sure they last you a lifetime. So depending on what procedures and how many teeth we're replacing, but for straightforward single dental implants for a tooth is about $4,000 to $5,000, and that's the whole amount. So you'll probably be up for about half of that in the first stage for the surgery, and then half of that again in about 6 months later for the second part of the treatment. For the people that are a little bit more cost conscious, we do have a free, interest-free payment plan available called My Smile Plans. And if that's what you need, more than welcome to discuss that with us.